Oh, hi. Today's episode is about how to manage nausea at home and things your doctor can prescribe to help. So, this video is for educational and entertainment purposes only. If you're feeling very nauseous, please let your doctor know. Please give them a call. There's so many medications out there that can help reduce nausea, and there's different types. So, being as specific as possible when you call in to talk to the doctor is helpful so they can prescribe something that can target your particular issue when it comes to that. Um, Unfortunately, sometimes with chemotherapy, you can experience anticipatory nausea. So, that means when you already had a really bad experience from it, you start to feel very nervous, and then you get an upset stomach from that. What would help with that is if you do some relaxation techniques, whether it's box breathing, which is when you inhale for 4 seconds, hold your breath, exhale for 4 seconds, hold your breath, and just continue. That breathing exercise can help relax you. Also, you could use visualization. You can see a therapist if you're having a lot of anxiety, like that's what they're for. Um, Also, they can, if it's very severe enough, sometimes they'll prescribe like Ativan for that as well. In addition, if you have really, really, really bad nausea, you also have a medication called Zyprexa. So Zyprexa, like they use that off-label in order to help with very severe nausea as well for chemo patients, even though typically it's used for different reasons. It's just that nausea can occur for a different variety of reasons, whether it's because of your stomach being upset, your digestive tract being upset, or if there's or neurotransmitters are triggering like the vomiting reflex in your brain. So sometimes they can block those receptors, and sometimes it helps, particularly. So that's why sometimes you'll see medications and wonder, like, okay, why did they prescribe that? It's because it can help with other mechanisms in the body that might be causing it. So that's good news. The more medications out there in different drug classes that work in different ways, all that is great because that way you can find the one that's going to help you in your situation. Um, so, like for example, like for me, they put me on Zofran and Compazine. Those two medications, or for me to take just in case if I experience that at home to use as needed. And also before my treatment, before my infusion, like right when I'm there, like they'll give me um, Decadron, also known as dexamethasone. Also, they give me Pepsid. That's going to help like protect my stomach lining and also reduce any reaction to the chemo itself. Um, those are two things they give me that I think is helping so far. Also, at home, I take other medications as well that helps prevent it for different reasons. So there's a lot they can do. Um, Also, there's a lot of things that you can do at home. For example, if you have the type of nausea where you get really nervous and feel sick, you could do like different types of like relaxation exercises or breathing exercises. Or if it's severe enough, your doctor can prescribe you something to help calm your nerves as well to use as needed. Because unfortunately, that's one type of nausea that can occur if you're someone who's naturally anxious. Because I'm sometimes very anxious myself. Also, sometimes you can have acute nausea from chemo, which is you get nauseous within the first 24 hours, or delayed, which means you can experience it past the 24-hour mark, like it hits you like in day 2 through 5 after your infusion. So that's just something. So your doctor needs to know like the timing of it and what medications you're already on, because if two medications are like sedating, they don't want you on that because that just increases that side effect, for example. So they need to know everything you're taking, supplements over the counter. That way they can safely prescribe you something that can help, and also they already know what drugs they have already prescribed that didn't help, so they can look at a different drug class of medication that might help. So hopefully that's helpful. When it comes to like non-prescription stuff that can help with nausea, there's quite a lot. Ginger, that's known to speed up your digestion, which is really helpful. Also, you got peppermint oil, which helps relax the digestive tract in your body. That might be helpful as well. Both for those two things, you want to make sure it's not artificial, it's like the real thing, the actual ginger root, like extract or peppermint oil, that kind of stuff. So, for example, like the Altoids, the number one ingredient, the first ingredient that's listed is peppermint oil. So that's Altoid is that's a good choice to have and have on hand just in case if you feel nauseous. And then when it comes to ginger, you can get ginger tea or ginger candy. The ginger candies, this is just like one of the brands you have, and this is very easy just to carry with you. And some of the ginger teas, all you gotta do is just add like hot water to it. Don't even have to deal with like tea bags, which just reduces one extra step, right? So we talked about those medication wise. Also, like I said, there's other things that can help. For example, acupuncture. Some people benefited from that. Some people benefited from doing a very controversial medication or drug. That's marijuana. So for some cancer patients, marijuana has been very helpful to reduce their nausea, which is really great. But only do it if it's legal in your state and monitored by your doctor. But I just wanted to throw that out there. Like, I'm neither pro or against. I'm just do what's legal in your state, okay? And what might help you. And your doctor needs to know everything you're taking, like I said, because things could interact. And also the timing of when you eat. With chemotherapy, like if my stomach is empty for too long and I have low blood sugar, then I'm more likely to feel nauseous. So I make sure like an hour before like my chemo starts, like I have something in my system, because an empty stomach is going to actually make me feel more nauseous. And then when I eat, I just like wait an hour or two and then I eat as well. So that timing works well for me. Yours might be different. Most people, it's good for them to have a light breakfast like an hour or so before treatment, and then eat something like a couple hours after. That way, the timing of meals help. And like I said, if the meals are small, it's easier for your body to digest it. So instead of 3 big meals a day, try to do 5 to 6 small meals a day. Just break it up, right? That could help. Let's see. I want to make sure I'm not missing anything. Let's see here. Also, it's important to maybe treat the cause of it. What people don't know is that sometimes severe constipation can also make nausea worse too, just because everything's backed up and digestion is getting impacted that way. Or if you're dealing with a lot of issues with stomach acid buildup or things like that, they just need to know what's going on. So we can go ahead and treat either the cause or the symptom, those kind of things. And also after you eat, make sure you're sitting up. That's going to help with digestion and less likely for you to have heartburn and stuff. So after you eat, don't immediately lay down, right? Just sit up, okay, for an hour or so. And also walking after meals, sometimes that helps with digestion as well. And we talked about also acupuncture. That's helpful in some cases. We talked about relaxation exercises. We already talked about marijuana. If it's legal in your state, that's something that you can possibly be prescribed that might help you. Treating the primary cause, which in my case, low blood sugar or stress or constipation, those things. Aromatherapy, that's something that could help for sure. And it doesn't matter which one. Let's say you don't like the smell of peppermint oil. Well, lavender, that could also help kind of keep you calm, relax you, and might even help with nausea as well. And it's very simple to do. You could put the essential oil on a cotton pad or a tissue or anything, or put it in an actual diffuser. If you're also getting a metallic taste from chemo, you could use plastic utensils. That way you don't have which would help. Also, sometimes people have small meals or have mints on hand as well. Let's see. think that's all. Also, there are some great resources. For example, there's the National Institute of Health. They have this guide here. You can get it online, but my dietitian actually and my care manager gave me a copy, like an actual hard copy, which is great. Your dietitian at your cancer center, they might be able to work with you, so I highly recommend them if you if you often get nauseous. I like how this is set up because it's set up by like symptom. You don't have to read this whole thing from front to cover, but if you have a particular side effect, let's say like mouth ulcers from chemo, nausea from chemo, you're losing a lot of weight, like this has a lot of helpful information and has a little bit of like recipes in here too. Not a whole bunch, but definitely recommend this. You can actually download this online from the actual website, National Institute of Health. Just FYI. And this one's called Support for People with Cancer, Eating Hints Before, During, and After Cancer Treatment. And also when it comes to medication, if your doctor prescribed you something for nausea and it's like really pricey, sometimes if you go online on like goodrx.com, so goodrx.com, like they'll post like coupons and stuff you can take to the pharmacy, right? And that will help lower the cost. Or if you're on any other medication that's really expensive, you can go to like an actual drug manufacturer's website, and sometimes they have something called a PAP program, which is Patient Assistance Program. So that way, sometimes drug manufacturers have like financial aid assistance for people who can't afford their drugs, and all you have to do is just apply for it, and then also have your doctor fill out the application online, or as well. So definitely don't get discouraged. There's a lot of stuff you can do, and hope this was helpful. If I missed anything, I'm sorry about that, but definitely, and if you want to as well, you can place a comment below too about things that was helpful for you as well. Thank you. Have a great day.